Hello, my name is Nicole Boyer, and tonight I'm going to be presenting on community-based care transition programs. So throughout the semester, we've learned that care transitions occur when a patient moves from one care setting to another. A majority of the participants are either elderly or individuals with chronic conditions or some type of complex illness. Currently, we have a massive issue with transitioning patients between care settings. So think of it as a hospital to a home setting or a hospital to a nursing home setting. Our healthcare system fails due to rushed care. So those of us that have worked in hospital settings or like subacute, post-acute rehab, you kind of know that you're taught to get the patient in and out as fast as you can in order to get paid. So this rush causes a simple lack of communication between healthcare professionals and providers, and basically that's what's causing the poor transition, which causes unhappy patients and then readmissions. So throughout my research, I found an interesting statistics about 1 in 5 Medicare patients discharged from a hospital are readmitted within 30 days, costing $26 billion every year. Majority of this cost could actually be prevented. So this lack of communication between providers causes confusion about patients' condition and plan of care, duplicate testing, which can be very expensive, inconsistent monitoring, med errors, delays in diagnosis, or even misdiagnosis, lack of follow through with referrals. So this lack of communication is pretty much the key reason that we have a failure in care transitions. So these poor transitions cause patient safety concerns, issues with quality of care, health outcome concerns, financial burdens for the patient and even their family members, and then an increase in hospital readmissions. So the care transition program was created to improve care transition nationwide. It was created by Section 3026 of the Affordable Care Act. So it was announced in April 2011 that CMS would fund any acute care hospital with high readmission rates that partner with CBOs. So it officially launched in February 2012. It's part of a partnership for patients, which basically funds, acute care hospitals that have high readmission rates, and then basically, wants to reduce hospital acquired conditions. So funding included over $500 million from CMS for the program between the years of 2011 and 2015. So the program overview, kind of what it is they're basically providing funding for test models that improve care transitions for high-risk Medicare patients by using services to manage patients' transition. So the main goals of the program are to improve transitions from inpatient hospital settings to other care settings, improve quality of care, reduce admissions for high-risk beneficiaries, and then document measurable savings to the Medicare program. So the current program is at capacity and currently has no future plans for additions. There's 47 sites currently in the nation. It's a pretty in-depth application process for a community-based organization to either be considered a participant, and most of them in the nation are either area agency on agings or they're aging and disability resource centers. So what I did is I did some research in my area, and there's actually only one CCTP in Michigan, and it covers the Southeast Michigan community. Basically, what this does is there's 5 strategies that are being funded to improve care transition. Most of them include some type of health coach, which health coaching would be, basically what they said is 6 to 7 hours of bedside coaching. There's post-discharge and home visits within 72 hours of discharge, weekly telephone consultation during the 30 days following the discharge. Some strategies include the use of a health coach and a discharge planner, kind of, getting them together with you and going over any, medication directions, literacy issues, education when you go home, finding out what your needs, your diet, your upcoming physician appointments, and kind of getting those all ready and for you to understand that. Also, there are behavioral health support issues if a client has some type of behavioral need. providing care managers for those that have a lack of caregiver support and might not be able to afford access to certain services. Some examples throughout the program was providing emergency response buttons like those little med alerts, medication management assistance, transportation meals, things like that. One of the things that I found interesting was strategy 5, which I go pretty in depth in my paper, is the skilled nursing facility coach. So basically that person is obviously helping someone who's transitioning to SNF. So they prepare the patient for discharge to a facility, and they assure the accurate transfer of not only all of their medical information, but also their person-centered information. But the strategy is only over a 96-hour period, so it's not very long. The following are some challenges that I found and some modifications for improvement. I kind of put them into groups, short-term challenges and then future challenges. So the short-term challenges are kind of things that could be easily modified, perhaps, shorter amount of time. Than the future challenges might need some kind of policy changes. So the first thing is hiring the appropriate personnel with appropriate skills. They need to constantly ensure that their hiring process is tweaked to fit their needs. Ensuring that they hire people that are fast-paced workers, but also are highly effective with motivating patients to participate in their program, and then, provide effective transition. So kind of pinpointing those star employees and then using it as a resource in order for them to hire future employees, kind of make it something to look for to hire like the perfect employee. Developing systems to manage information and quality assurance. I mean, that's kind of always ongoing for any program you have. Ensuring you do, kind of assessments and monthly check-ins and surveys to assist you in developing the program and ensuring it's meeting the needs and meeting satisfaction, which I go into depth in my paper. The Michigan-based one had some issues with access to electronic health records, which I found kind of interesting. It wasn't last year, it was February 2015. Finally, all of the skilled nursing facilities in Michigan had to go paperless and be part of the EMRs. So there was some information about how they had issues to access of these electronic records. So I think it's very, very important for someone to have this access, because this is how they would pinpoint an at-risk patient in order to get them to join their program. So it's very, very dire that they have access to electronic health records in order to assess different people who need to be part of the transition program. So, and then lastly, in the short-term section is in-depth post-discharge checkups in nursing skilled facilities. Reading over kind of the idea of the skilled nursing coach, I personally didn't think it was long enough, 96 hours, because it's kind of ongoing. I worked in a skilled nursing facility before, and we also had a short-term unit, and it was just kind of a lot of confusion and, a lot of, upset family members or upset clients or residents. And so kind of, having a more in-depth process, not only having them fax over like a tiny piece of paper that says, this is their name, birth, and birthday, and some of their, diagnoses, but kind of, doing check-ins, not just over the phone, but coming in and checking and then talking with staff on how to improve their care, I think would be super beneficial. Some future challenges, a main one that's, probably going to be taking some time, is broadening the eligibility requirements for the community-based organizations. So basically, since there's only 47 sites in the nation and only one in Michigan, it would be highly beneficial to broaden that number in order for the CBOs to reach the communities and provide more enrollment rates, so therefore decreasing even more hospital readmissions, which would be, overall saving them money. However, I know this process would basically need to be accepted by CMS, and that would probably only happen with results. So the program's only been in effect for 4 years, and I think at the 5-year mark, they were going to see if they're going to increase it or not. So kind of, I guess we can look forward to that in upcoming news reports. A third future challenge is increasing hospital partners that have effective communications. Basically just ensuring and assessing that your hospital partners aren't only, just a list on your list, but you're actually utilizing them, and they're actually, assisting you and supporting you in the process. Um, I noticed too in the Michigan-based one, obviously it was only local hospitals. They only had 4, and there's quite a bit in the southeast area of Michigan that are really well known. So it was kind of confusing that they only picked those 4. So just kind of always assessing over that, and making sure that you have the proper people working for you, and it's not like a pain. They're kind of doing what they're supposed to do. And then lastly, I think it would be beneficial for community-based organizations to be out in the community more, because with the older adult population, sometimes they're set in their ways, they have a routine, they might use something or go to something that they know that it's a well-known name. So it would be beneficial for community-based organizations to be out in the community offering providing services as a general part of their mission in order to become more well known. So, going to senior centers and maybe providing like an educational topic or something. So then if, they affect a certain number of patients at that senior center, if one of them goes into the hospital and they have a choice to use the program or not, they may use it because that name is more well known. So lastly is the impact that this program has on the elderly. So overall, which I go more in depth into my paper, is basically the improvement in the recovery of a health condition based on a proper care transition, quality of care, quality of life, satisfaction of service received, and then reduction of healthcare costs. It's a huge thing to have proper care transitions. It's a really stressful time for people moving from one to the other, especially if they've been in an area for a long period of time. The people know them, the people know their conditions, and now they're going to a new area where their rights aren't being followed, their personal centered choices aren't being followed. So it's a huge deal to have this good program in place in order to just kind of prevent those and just ease the stress and just ease the satisfaction of our elders. So especially with the baby boomers increasing, I think there's definitely going to be a more demand for this. So thank you so much for listening to my presentation, and I hope you all have a great evening.